Yes, this is Module 8 of Marriage Counselling and Management course. So in this module, we'll talk about marriage counseling process and professional practice. Knowing what to say to a struggling couple is essential. But knowing how to structure the therapeutic process, adapt to different populations, develop skills progressively, and maintain ethical boundaries is equally critical. So this module will transform theory into clinical competence. Okay, it will just transition into how to practice professionally. Okay, so it will cover marriage counseling processes, counseling to newlyweds, old couples and singles, beginner, intermediate, and advanced counseling techniques, communication, conflict resolution and therapy skills, ethics, confidentiality, and record management. Okay, so before you schedule intake and safety screening, first things first. Before scheduling, screen for current domestic violence. If yes, couples counseling is contraindicated. Then screen for intoxication or withdrawal. Then screen for suicidality or homicide risk, so that you know whether your client is at risk. Then after that, you begin to build rapport. You explain process. In this case, counselor is neutral. You are not a judge as a counselor. You are very neutral. Then gather each partner's perspective, maybe 10 to 15 minutes or uninterrupted. Don't interrupt them. You can seek from the male partner and the second partner, so that you know, so that you give a balanced counsel. Don't forget, you are not a judge. You are a counselor. So observe interaction. That is interactions. Observe. Sometimes you can see non-verbal cues like body language and even emotional reactivity. Okay? But before you start, set at least 1 to 2 concrete initial goals of the counseling. So this first section of counseling sets the tone. Okay? Screen for safety first. Then after that, you now understand before you intervene. Allow sensitive disclosure. Okay? Not shared in front of partner. Review whether stories are consistent. Then assess individual functioning, whether they are with their mental health, their support system. Now, never promise confidentiality for disclosures about harm to the other partner. So you can use these assessment tools like prepare/enrich, which is proper for premarital and early marriage. Then you can use dyadic adjustment scale DASH, which is important for pre and post progress monitoring. And you can also use conflict tactics scale CTS. That is when you suspect domestic violence. You can also use PHQ-9 for depression and GAD-7 for anxiety. All these are assessment skills that have been developed, so you can take advantage of them. You can map family patterns. Use genogram to map family patterns across generations. This will help couples to see how their histories shape their current dynamics. That is what we use genogram for. So assessment is not a one-time event. It continues throughout treatment. So always use standardized tools like the ones we mentioned here to supplement clinical judgment. Now, how do you counsel newlyweds? When we say newlyweds, we are talking about where the people, couples that are about 1 to 3 years old in marriage. Okay? There are a lot of issues they face, like adjusting to living together. They are just coming from different backgrounds. They have to adjust to living together. Now, in-law relationship management, sexual expectations, disappointment that marriage is not what I expected. In the first 3 years, this is not what I expected in this marriage. So your focus, your counseling should focus on preventive emphasis. You begin to teach skills before problem becomes severe. Then you normalize early difficulties. Then establish patterns deliberately. That is for newlyweds. But newlyweds can still choose their patterns. Then explicitly negotiate boundaries with the extended family before resentment building. Now, what are the techniques you should use? Now, one is weekly marriage meetings. Always meet with them. Then try to assess their love languages. Okay? Then help them to create budget and financial transparency protocol. Then help them to script their boundaries, rehearse saying no to intrusive family requests. Okay? newlyweds are still forming their relationship habits, so you have to properly counsel them. Okay. And let's talk about how to counsel older couples. When we say older couples, we are referring to couples that have about 10 years or above. So, they face issues, peculiar issues such as empty nest syndrome, retirement adjustment, accumulated resentment, caregiving strain, loss of intimacy, infidelity discovery after so many years. So, the counseling should focus on first, you have to respect their longevity. Build on the strengths that have kept them, what have kept them for this long. You have to build on it. Then expect slower change. Okay? Then address forgiveness. Tell them to forgive each other. Past hurts. Okay? Then identify shifts. Identity shifts after children leave or work ends. There is a shift of identity because life transition their focus. So you have to counsel in that area. You have to also counsel on what they want their marriage to stand for. Okay? The specific techniques you can use include structured forgiveness protocols like written letters, forgiveness ceremonies, Then you talk about life review exercises. Help them to reflect, tell them to reflect on their marriage history together, where they are coming from, what they have managed, what they have fought together, what they have achieved together. It will help them to now see that if they can stay to this point, they can also stay for the next future. So rebuild intimacy exercises, like maybe there may be non-sexual talk, date night, shared planning. Then you can also give caregiver support and respite planning. This is for couples that are facing illness. So older couples have decades of history. This history can be both painful and beautiful. So honor both of these history. So honor their pains and their beauty. Change can be slower, but I can assure you change is possible. Now, let's talk about counseling for singles. Okay, singles need to be self-aware. They have to be ready. There are singles that are preparing for marriage. Maybe they are engaged or seriously dating, and there can be ones that are recovering from relationship loss, maybe breakup, divorce, or death. So these are the group we are talking about. So for those that are preparing, you have to make them self-aware. What do you bring to this relationship? You have to also explore their readiness. Did they want to go into this marriage because they want to escape loneliness or pressure? You have to also look at that. You also address past relationship patterns and also carry out premarital assessment even without current partner. But for those recovering, you have to validate grief without pathologizing. Then you have to also assess for complicated grief or trauma. Okay, so the techniques you can use can be attachment style assessment. You can also use genogram to know their history, cognitive restructuring, and also dative skill practice. Singles counseling is often overlooked by marriage counselors, but this is more preventive. Is very important so that singles can be properly guided. Okay, now let's talk about beginner techniques, which are foundational competencies. Now, you have to practice active listening, reflect content and feeling, paraphrase, and check understanding. After that, you track, that is, you follow the conversation to ensure that each partner completes their turn. Then after that, you go into normalizing. This is when you validate that common difficulties are not signs of failure. Then after that, you set and maintain therapeutic frame. Okay? Then you now begin to reflect empathetically. You articulate the emotion of the client. You articulate the emotion the client has not yet put into words. Then after that, you set smart goals. Now, for instance, instead of communicate better, what will you be doing differently? What will we see and hear? These are not negotiable. Do not move to advanced stage when you have not laid these foundational competencies. Now, there are also other techniques. We call them intermediate techniques. Okay, this is where psychoeducation, you have to teach couples about relationship dynamics and communication patterns. you have to also have couples interact directly in sessions. Then you reframe, that is, you offer new perspective that reduces blame and open possibilities. Then after that, you help them to rehearse their behavior, to practice these new behaviors in session before trying it at home. Then genogram is a very important tool you can use. Okay, you can map family patterns and connect to current marriage. Then after that, you can assign specific homework to generalize learning. So this is an example of reframe. What if we saw this not as you are too controlling, but as you have a deep need for safety? You can tell the couple like that. That need is valid even if the expression causes problem. Intermediate techniques require active direction. So it requires active, you don't just listen. You have to reframe, you have to also guide practice. Now, these are advanced techniques. Advanced techniques is very important for you as a counselor. This is when you talk about attachment-based interventions. You work directly with attachment, fears, and longings. Okay, so then you talk about emotionally focused therapy stages, where we talk about de-escalation, restructuring interactions, Then we talk about trauma-informed couple therapy. This is when you adapt for trauma histories, you prioritize their safety and avoid traumatization. Then after that, you go into discernment counseling. This is for couples where one partner is leaning out or considering divorce, and the other is leaning in, wanting to save the marriage. So the goal should be clarified, not necessarily reconciliation. Okay. Now, these techniques require significant training and supervised practice. So know your limits as a counselor. When you know that it is beyond your limit, you have to refer. Okay. Now, communication skills to teach clients. You can teach them to soften their startup, know how to listen actively and paraphrase. Then they should always use I feel statements, then validation, then turning towards bits for connection, and also practice in sections. These are skills. They can be learned, they can be practiced, and also mastered. So do not assume couples know them. Then if you want to resolve conflict, you have to use speaker listener technique, which can involve physical object grants, speaking right, use I feel, just as I mentioned. You can also use repair attempt protocol, where you say I am sorry, and co. So teach this protocol explicitly. Okay. Now, we have seen that this model equips you to build a professional practice that is structured, adaptable, skilled, and ethical. So this will help you to serve couples properly with competence.